Hi, my name is Dr. Tiffany Topp. I'm an occupational therapist and certified lymphedema therapist. Welcome to my series. So what is lymphedema? What do we need to understand about the body to understand the body's overflow system? Well, to understand the lymphatic system, you got to understand how all the fluid moves in your body. So when we look at the body as a whole, we're about 60-70% water. So we have water in our body, fluid in our body that is either in a system or out of a system. So one fluid system that everybody knows is the circulatory system, the blood system. So when we're looking at the body, we need to understand that the blood system, the circulatory system, one of the jobs of the blood is to release water and proteins and nutrients out of the blood capillaries. And what that does is that feeds the cells of our body. And when the cells of our body take in proteins, take in nutrients, they go through their own metabolic thing, and then they put out waste. And that waste just goes and just floats in the free-floating fluid of the body. Now, the lymphatic system's job is to take up the excess fluid. So what happens when the water comes out of the capillaries, a lot of it, most of it actually enters back in the veins and is recirculated in the body. But there's about 10 or 15% of that water that comes out of the blood that does not return back to the blood, and that's what sits in the tissues. So it's the lymphatic system's job to pick up any of the fluid that didn't make it into the veins, and their job is to take that fluid through lymph nodes. Lymph nodes is where the immune system is. That's where it's going to clear out anything that doesn't belong in the body, because ultimately the lymphatic system's job is to filter the excess fluid that's out of the systems, bring it through to the lymph nodes, clean it up, and then return it back to the bloodstream. So if we were to start at the foot, if fluid enters at the foot and then it goes up into the lymphatic channels, goes through lymph nodes behind the knee, goes through lymph nodes in the groin, inguinal lymph nodes, goes through pelvic lymph nodes, where it eventually turns into one big tube that takes all that cleaned and filtered lymph fluid and returns it and puts it back into the bloodstream in a vein that is right behind your collarbone. So the left side takes up all the fluid from the legs, the lower abdomen, and the left side of the trunk and the arm and the face and the head. The right side only takes up the fluid that is in the right upper quadrant of the trunk, the arm, and the right side of the face. So when I say that fluid is free floating in the body, that's not exactly accurate. It only floats so far. So you're not going to have fluid from your abdomen making its way down to the feet. It's not what happens. So if we were to cut the trunk, for instance, in half and then cut it in half again at the belly button, the upper quadrant, it has watersheds. So we have a watershed on the right and a watershed on the left, and then the lower quadrants have their own watersheds. So all of the fluid in one watershed drains to one specific set of lymph nodes. So if we were looking at the upper quadrant, all of the fluid eventually makes its way to the lymph nodes that are under the armpit and then makes its way back to the bloodstream. So when there's a disruption to the lymphatic system, like lymph nodes are removed after breast cancer, you have lymphatic vessels that are trying to send fluid to a lymph node that is no longer there. So that lymph vessel gets congested and can't accept any fluid, so that ultimately ends up with fluid accumulation. And that's when we have lymphedema. So if you had some type of abdominal surgery, or you had radiation because of something in the lower part of the body, cancer-wise, radiation can destroy or impair some of the lymphatic vessels, and that can cause a backup of fluid. So it's very important that we understand the workings of the lymphatic system before we ever talk about treatment, because if you don't really understand how the lymphatic system works, then you're not really going to understand why the treatments that we give are effective. So there are different ways that we can treat lymphedema. The gold standard of lymphedema treatment is complete decongestive therapy. Now, with complete decongestive therapy, there are 4 components. We have skin care, making sure the skin is clean and moisturized daily. Exercises, because lymph fluid does not have a central pump like the heart does. It relies on the muscle pumping to move the fluid along as well. So then we have manual lymphatic drainage, which is a way of moving fluid faster than usual to help to decrease the accumulation of fluid in the tissues. And then we have compression, because everything in the lymphatic system, in the blood system, all is based off of pressure, hence the term blood pressure. So it's the pressure, it's like diffusion, osmosis type thing. We have pressure that puts the water out of the capillaries, and pressure is involved with putting the fluid into the lymphatic vessels. So when you add external pressure, like a garment or a wrap, what that does is it slows the blood from putting out as much water, and at the same time increasing the ability of the lymphatic system to take up that fluid much faster. So I'll do more on complete decongestive therapy in another video, but as an introductory video, that is the gold standard. In the next video, we're going to talk about the different types of lymphedema, primary versus secondary, and we're going to touch on a little bit about lipedema. Thank you for watching, and remember, please subscribe and follow so you don't miss any of the additional videos that I put out.